Hello everyone. I am Dr. Santosh Kumar based in Kolkata, Orthopaedic and Joint Replacement Surgeon based in Kolkata. I head the Poorva International Orthopaedic Foundation, and it's my dream to make Calcutta an international hub for orthopedic surgery, and we are here to deliver you the best at the most reasonable price. And in our video series, which earlier we have discussed several things like joint replacement and other aspects of orthopedics. So today we will be discussing about knee injuries, knee sports injuries. Well, knee, as you know, is one of the biggest joints in the body, and it is susceptible to injury in various forms, especially sports or road accidents and some other kinds of injuries. So several times the bone breaks, that is known as fractures. We are not discussing that now, but several times bone doesn't break and the ligament and the cartilage takes the stress, the impact, and they break. So that is known as ligament injuries or cartilage injuries. Well, the most common way to get these injuries is sports injuries, like we discussed, whether it is football, hockey, cricket, and sometimes it is road accidents like motorcycle accidents. Sometimes it is some elder people get this type of injuries while going to the sea by sudden sea waves. Also they can get this type of injuries. Whatever the injury may be, the first presentation of knee injury or knee ligament injury or cartilage injury will be a swelling. Like we will be able to notice that if you see the normal knee, it is something like that. This is the structure of a normal knee, and immediately after injury we will see there is a swelling. So this swelling signifies an internal injury. If the swelling is immediately within hours, then most likely it is a ligament injury. If the swelling appears after 1 or 2 days, then most likely it is a meniscus injury. So this swelling is of immense clinical significance, that there is some injury. If there is no swelling, that means it is unlikely that there is any major injury. So just to go through the structure of the knee joint, like knee joint is a junction of two bones, the femur and the tibia. So femur is the thigh bone and tibia is the shin bone, and in between this is the cartilage. These two bones are joined by side ligaments, which are known as collateral ligaments, and which are outside the joints basically, and there are two internal ligaments, one is ACL and another is PCL. And between the two cartilages there is a washer shaped cartilage which is known as meniscus. So this is the ACL, this is the meniscus, which we can see, and in subsequent photo we will see the PCL also. And in this photo we can see the PCL, the one which is behind, and these are the collateral ligaments which are just outside the joint, adjoining the joints. So collateral ligaments are the stronger ligaments, and collateral ligament injury is a bigger problem, immediate problem but intrinsic ligament injury is of tremendous significance, in the sense that it causes micro and macro instability to the knees. So micro instability is often felt as a feeling of insecurity or instability at knees, and sometimes there is giving way, which is known as macro instability. So this again I have shown the anterior cruciate ligament in the fluorescent color, and once the ligament injury occurs, if we do an X-ray, most of the times we do not see anything, because X-ray we can see only fractures, we cannot see the soft tissues in X-rays. So to see this we need a MRI, like this is an MRI. And in this MRI we can see cartilage and the ligament injuries. So once there is an injury, the next step will be to do what is known as arthroscopy. Now what is this arthroscopy? Arthroscopy is basically a keyhole surgery in which we make two holes. We make two holes around the knee joint. One is the inside, another is the outside, and through the inside hole the telescope goes, and through the outside hole one instrument goes. We connect this to and throughout the process generally saline goes inside through a cannula, and we connect this to a TV monitor, wherein we can see everything in a highly magnified manner, and we do the study first. We first study what are the problems, and then we do the repair or the reconstruction. So this is what it looks like in an arthroscopy. Once we put the telescope inside and see the TV screen, this is what it looks like. There is the ligament ACL looks like this. This is a picture that we roughly get, and the cartilage, that is the meniscus, looks like this. And for you to understand, we will just simplify it in a schematic diagram. So this is a schematic diagram. The ACL is inside from behind to back, and this is the meniscus, which is the washer shaped cartilage. Several times there is a tear in meniscus known as bucket handle tear or other types of tear, which can be seen like this, and there are the collateral ligaments on the side. So this is how it is seen in this arthroscopy. Once there is a collateral ligament injury, it has to be repaired, and it several times along with repair, internal bracing is done with proper suture materials, and this is how it looks like. There is the collateral ligament injuries have been repaired with sutures, and then there is internal bracing has been done by using interference screws and by using fiber tapes. So internal bracing gives immediate strength to the repair so that the person can walk from the very next day. That is the beauty of internal bracing. So this internal bracing is done for collateral ligaments, that is the intrinsic ligaments, as well as for ACL reconstruction, that is the intrinsic ligament. So once we have to enter the joint, we start the arthroscopy. First we make ports. So this is a keyhole surgery. We make 2 small holes using the knife, and then through one of the holes the telescope goes, and through the other hole the instrument goes. This is how it looks like. Through the holes the telescope and the instrument goes. So it is a completely keyhole surgery. Only through 2 holes the surgery is done, and there is no cutting that is generally involved. There is no major cutting that is involved. That is like laparoscopy in the abdomen. So once we find there is a cartilage tear, once we find that there is a meniscus tear. Now what is this meniscus? This meniscus is the washer shaped cartilage between the 2 bones. So once we find there is a meniscus tear, if it is repairable, then we repair it. We repair it using staples and sutures. There are techniques like outside in technique. We repair it using sutures. And if we find that it is irreparable, then we have to trim the part, and that is known as meniscectomy or meniscus balancing. That is properly known as meniscus balancing. So in this figure we are just trying to show how it is being repaired. Similarly, one more picture will show you how it is being repaired. This is how meniscus tears are being repaired. We try to repair it. Now the good thing about repair is that the meniscus is preserved, but the bad thing is that immediate weight bearing may not be allowed for the very next day. We have to protect the repair sometimes by partial weight bearing. And if we find that the meniscus tear is not repairable, there are criteria for what we consider repairable and what non-repairable. Then we just trim it around with an instrument, and that is known as meniscus balancing. This trimming is known as meniscus balancing. Now this trimming solves the problem of locking and pain. The bigger problem with meniscus tear is locking and pain. So this trimming itself saves the problem. Now how does a torn ligament look like in an arthroscopy? This is how it looks like, a torn ligament in arthroscopy. It has got frayed fibers like an octopus. It has got frayed fibers, torn ligament, and once we reconstruct it, this is how it looks. It looks beautiful, taut, thick and glistening, and this is a sign of a healthy reconstructed ligament. Now how do we reconstruct this ligament? What is the material that we use? Most of the times we use autogenous grafts, means we take tendons from our own body, and the commonest tendon that is being used is the hamstring tendon. The commonest tendon that is being used is the hamstring tendon. Hamstring tendon is made quadruple stranded. It is tensioned, it is made taut, and then it is used. After tensioning and making it taut, it is used. The hamstring tendon uses a graft, and it is fixed between the tibia and femur, making tunnels. There are tunnels which are made, and it is fixed. Along with that, so this is how it looks like after reconstruction. The same graft which I showed you after reconstruction, this is how it looks like. It passes through the tunnel in the tibia, it passes through the tunnel in the femur, and once it is fixed, this is how it looks like, the new ligament looks like. Now along with that, along with the hamstring tendon graft, quadriceps tendon graft, sometimes Achilles tendon graft, in earlier days we used to use patellar tendon graft. That is the graft which is used from the patellar tendon. It has got bone chunks on both ends, so bone to bone fixation is very strong. So that is, but there is several times anterior knee pain. So this type of graft has been less used nowadays. But this is how graft is fixed. The tunnel is made in tibia, the tunnel is made in femur, the graft is passed and it is fixed with interference screws or endo buttons. So this is how it is fixed. And if it is a bone to bone fusion, it generally occurs earlier, like in patellar tendon, but it causes anterior knee pain, and patellar tendon grafts are lesser and lesser used nowadays. So once the graft is passed through the tunnel, this is how it is fixed. This is the interference screws by which it is fixed, and this is how it looks like inside the arthroscope. And this is our arthroscopy surgery. After the surgery, this is our arthroscopy OT, in which we are seeing it on the TV screen. Whatever we are doing inside the knee, we are seeing it on the TV screen. And presently we are using other recent techniques like internal bracing in this ACL reconstruction. Now, what is this internal bracing? The whole idea of making internal bracing is to enhance the ligament, so that and to give its immediate strength, so that the person can walk full weight bearing from the very next day, and the ligament is protected and made safe. Along with the graft, we use certain fibers and sutures which is mixed with the graft, and it gives enhanced immediate strength to the graft. That is, there is no waiting period, and it gives immediate strength to the graft. So this is something very useful in nowadays, where people want immediate results. People are not ready to wait, so internal bracing techniques are used, and internal bracing techniques are also used for collateral ligaments also. In previous picture also we saw how internal bracing techniques are used, wherein along with the repair reconstruction, it is enhanced with suture material or tape, and it is fixed like that. Fiber tapes are also used in ACL reconstruction, wherein the fiber tapes are placed along the tunnel along with the graft. But autograft has to be there, because autograft can only integrate with the bones and become a natural thing. Any fiber tape, only fiber tape will not become a natural thing. So it will have a fatigue limit. After years it may fail, but natural graft is, autogenous graft is still the best material for ligament reconstruction. This is how our OR setup looks like. Our OR setup for ACL reconstruction, we have been doing it routinely, and this is how our newly reconstructed graft looks like. A very newly reconstructed graft. We are seeing it through the arthroscope, and this is our OR setup. So right now, if at all you need any kind of knee arthroscopic surgery or any kind of joint replacement even, please do come to Kolkata, and we will give you the world class orthopedic treatments at the most affordable price, and we will help you. If you are coming from outside, we will help you in all possible ways for your travel, your stay, so that you have a pleasant experience here, and we will make sure that you get the world class orthopedic surgery at the most affordable price. If you have any queries, you can email me to my mail ID santdr@gmail.com, or you can WhatsApp me at 9831 911 584. Thank you.